All right, today we're going to talk about a bone you're already very familiar with, even if you don't know its name, the humerus. This is the big, foundational bone of your upper arm, and trust me, it's got a few surprises up its sleeve. Oh, you know the feeling, right? We've all done it. You bump your elbow just the wrong way, and bam! This weird, buzzy electric shock zings all the way down to your pinky. It doesn't really hurt, but it sure isn't funny either. Well, here's the big secret. Your funny bone isn't a bone at all. What you're actually feeling is your ulnar nerve getting squished against the very bone we're talking about today, the humerus. And that little fun fact is the perfect way to start exploring this incredible structure. So let's get a little more formal. What exactly is the humerus? It is, hands down, the longest and strongest bone in your entire upper limb. I want you to think of it as the main pillar of your arm. It connects your shoulder to your elbow, and it's the anchor point for some seriously powerful muscles, like your deltoid and your pecs. To really get to know the humerus, we're going to take a little tour from top to bottom, and we're starting right up here, at the upper end, the part that anchors into your shoulder and gives you that amazing range of motion. Now, this upper region has several really important landmarks we're going to look at, from the ball of the joint to all the different bumps and grooves where muscles attach. Every single one has a critical job. First up is the head. It's this beautifully smooth, almost perfectly round structure. This is the ball in your shoulder's classic ball and socket joint. It fits right into your shoulder blade or scapula and lets you swing your arm around in pretty much any direction. Now, here's where it gets a little weird. The humerus doesn't just have one neck, it has three. And while they're all important landmarks, the one that doctors are most concerned about is the surgical neck. You can probably guess why. It's a slightly weaker spot just below the big bumps at the top, which, yep, makes it a super common place for fractures. Next, if you look at the top of the humerus, you'll see a big, prominent bump called the greater tubercle. This thing is like a major docking station for 3 of the 4 crucial rotator cuff muscles that keep your shoulder stable: the supraspinatus, the infraspinatus, and the teres minor. Okay, I know what you're thinking. Supraspinatus, infraspinatus, teres minor, that is a total mouthful. There has to be an easier way to keep those straight, right? Of course there is. The trick is super simple. Just sit down. S-I-T. It stands for supraspinatus, infraspinatus, and teres minor, in the exact order they attach from top to bottom on that tubercle. See? Simple. Okay, nestled right between the 2 tubercles, there's a groove called the intertubercular sulcus, and you guessed it, it's another busy hub for muscle attachments. 3 really powerful muscles hook in here: the pectoralis major, the teres major, and the latissimus dorsi. And don't worry, we've got another fantastic little memory trick for this one. Just picture a lady between 2 majors. The latissimus dorsi, that's our lady, attaches right in the middle of the groove, perfectly sandwiched between our 2 majors, the pectoralis major and the teres major. It's a classic. Okay, let's move down from the top and get to the shaft. This is the long central part of the bone. You can think of it as this incredibly strong pillar that provides a huge surface for some of your arm's most powerful muscles to grab onto. The shaft isn't just a simple rod, though. It's got this rough, V-shaped area called the deltoid tuberosity. That's where your big deltoid shoulder muscle inserts. And this is really important. It also has this shallow spiral groove that acts as a protected highway for the radial nerve as it travels down your arm. All right, our tour is heading to its final destination, the bottom of the humerus, the lower end. This whole area flattens out and gets way more complex because it forms the elegant and intricate hinge of your elbow joint. The business end of the elbow has 2 main surfaces. On the outside, or the lateral side, you have the capitulum. It's a little rounded knob that connects with your radius. Then on the inside, the medial side, you've got the trochlea, which is literally shaped like a pulley. And the ulna bone fits perfectly around it. Now, to let you bend and straighten your arm all the way, the humerus has these really clever little hollows called fossae. They're basically just empty spaces that allow your forearm bones to move into when you bend your elbow, and for the point of your elbow to lock in when you straighten it. Pretty smart design, huh? A bone this complex doesn't just show up fully formed. It has a whole growth story. The main shaft actually starts turning from cartilage into bone way back when you're just an 8-week-old embryo. But after you're born, separate growth centers pop up at the top and bottom. Over the next decade or 2, these ends grow and eventually fuse onto the main shaft. That whole process isn't even done until you're in your late teens or early 20s. So we've toured the whole bone from top to bottom. But why does all this detail actually matter? Well, this is the real payoff. Knowing the specific map of the humerus is absolutely crucial for understanding what can go wrong when it gets hurt. Here's the deal. There are three major nerves that are in dangerously close contact with the humerus. The axillary nerve literally hugs the surgical neck. The radial nerve sits right in that groove on the shaft. And our old friend the ulnar nerve, the funny bone nerve, runs in a little tunnel right behind your inner elbow. A fracture in any of these spots can mean serious nerve damage. So, it shouldn't be a huge surprise where fractures happen most often. The top three spots are the surgical neck, the middle of the shaft, and the area just above the elbow. See a pattern here? Those are the exact same locations as our nerve danger zones. That fracture right about the elbow, it's called a supracondylar fracture, is especially common in kids who fall on an outstretched arm. And it is so serious because you can damage not just another nerve, the median nerve, but also the brachial artery, which is the main blood supply to your entire forearm and hand. And that brings us right back to where we started. The humerus isn't just a simple bone. It's a complex piece of architecture, a hub for muscles, and a protective highway for vital nerves and arteries. So the next time you feel that tingle, you'll know. It's not a bone at all. It's a nerve, reminding you of the intricate and amazing anatomy that lies just beneath the surface.